Welcome, Fran. Thank you so much for being up for joining us for this webinar. I'm just finding my little notes for our conversation. I've got them
No
here.
worries.
So in the next 15 minutes, we're going to start with a bit of the journey so far. And what we know is that you're working as part of a lived experience workforce of 150 colleagues, and that there is a whole range of roles, from your own role as trust head of lived experience workforce to advanced lived experience roles, peer workers, peer employment specialists, loads of different roles. Would you tell us a bit more about how you've got to this point and, yeah, that journey?
Absolutely. Well, yeah, thanks so much, Holly, and thanks for inviting me here today. It's a pleasure to meet all of you. Yeah, so I mean, our journey as an organisation formally sort of started with peer roles in about 2012. So even though we've had lived experience roles before then in some of our addiction services and some of our sexual health services, it wasn't sort of a formal kind of peer role before then. So in 2012, the first sort of two peer support workers were recruited as part of the organisation, and when I joined the trust in 2013, there was 5 peer workers and 1 sort of lead. So it's a really, really small team. And basically, we've just been growing ever since, both kind of in types of roles, but also in the kind of quantity of roles we've got. So we do have over 150 roles now. And really the journey has been, I mean, we've had some great sort of support along the way. Our CEO really champions our work. So there's a lot of buy-in and investment sort of in our infrastructure. And I think what became clear really early on is that having peer workers is really good, but we needed the infrastructure to be able to support the roles properly. There's so much research around actually the fact that the peer worker and lived experience roles really need sort of professional supervision, support structures around them to thrive in the teams that they're in, particularly because they're often working on their own in the teams, in teams that may not know much about peer support when they first sort of join that working space. So we had, we were able to make a lot of kind of changes around sort of how we were the infrastructure. So as the peer workforce grew, we started to introduce more senior roles in order to be able to support those. And our previous head of profession, Mel Ball, who some of you may have heard of before, really worked quite innovatively and pioneered some of our more advanced leadership roles. So that's sort of our journey has been certainly kind of propelled by a lot of support from senior leadership, and getting things wrong along the way and really trying to kind of figure out the best way to do things to be in a position where we are now with 150 roles and really kind of spanning lots of different sort of bands and areas, working areas.
Thanks, Mel. So that's really interesting to hear. And I think I was going to ask you about what some of the key enablers have been. And I guess like you've touched on some of that. And what I'm hearing is like that top-down investment has been really fundamental, and investment, financial investment's one thing, but also that value and recognition of the role that lived experience plays within the service. Is there anything else you'd add to that in terms of enablers?
I mean, I think the fact that we've had the autonomy to be able to guide our own policies and governance around how the peer and lived experience workforce has grown and the infrastructures that we needed around it, and that our voice sort of within leadership, kind of as our sort of lived experience leadership voices have been really heard and respected around that. So when we've been able to hold the line really strongly in areas and had the backing from sort of senior leadership within our exec board to be able to do that. So I think that's been a huge enabler, because I know that otherwise sometimes lived experience workforces are led by and run by people without lived experience, and who haven't actually had the professional experience of being in a peer role. So to be able to kind of lead from that lived experience perspective and that professional sort of experience perspective and be heard and respected in that way has been really important.
Mm-hmm. And I think there's something about that pathway as well. So there is like a significant pathway of roles, and has that evolved over time? Yeah,
absolutely. So I mean, we started off with as I said, it was sort of a handful of entry level, sort of band 3. I don't know, remind me if you have similar sort of bandings.
Yeah, we do have a similar sort of banding system.
Yeah, so sort of entry level band 3 roles, so really equivalent to our healthcare assistant and support worker roles, and then sort of a band 7 lead role. And that was it. And over time, we've evolved in that we've started to create a leadership team. So we've got there's 3 of us that kind of are our central leadership team. And we've got sort of our entry level peer support workers. We've got band 5 senior peer support workers that provide that professional supervision to our entry level roles. We've got advanced lived experience practitioners who not only oversee sort of the senior and peer lived experience workers that work under them, but also they oversee patches of our different service areas, including sort of not just our mental health service areas, but our addiction service, that's our health and justice. And they're really sort of the leadership team for that specific area, and they work much more strategically than peer workers might usually work. So all of our peer and senior peer workers always work much more clinically, whereas our advanced lived experience practitioners have much more of a strategic role, and they also lead on the co-production and involvement within their specific areas. So it's not just actually about the peer workers that are employed in the services, but it's also the voices of people that are accessing services right now and getting their input. And so they really lead on that in their specific roles. And then there's our central leadership team that oversees it all. So and really, I mean, it was impossible not to do it this way, because as the workforce grew, it became really difficult for one person to be able to, meaningfully oversee it all. So it kind of evolved organically in that way, because it became the only way that we could make it work.
Yeah, and you can see by the way you're describing that, you can see how that would evolve, and that is the natural evolution. And it's really inspiring to hear that has been allowed and invested in to create this whole workforce, and to hear a bit more about the involvement of people in different aspects of activity, like more clinical activity or the strategic stuff, and bringing in that kind of lived experience engagement aspect too. Thanks, Fran, for that. Something that you have spoken about is and I think what we've sort of chatted about quite a bit is the infrastructure, and I think you've illustrated that really well. And I'm wondering, I'm curious, and I'm sure others will be curious to know a bit more about, what does that look like? What does it mean to you guys, and what does it look like in practice? And I think when I'm thinking about infrastructure, I'm thinking about, whole approach to recruitment and support and reflective practice and development and learning and all of those kind of things. So tell us a bit about that.
Yes, absolutely. So as I said, sort of we've got kind of all those various layers of roles within the organisation, and some are sort of more clinical facing, some are more kind of strategic roles. I guess one of the things that we've been really clear on is that we don't recruit into roles unless there is the proper infrastructure around it. So as you can imagine, we often get services that are really keen on entry-level peer support worker roles, but they may not have a senior peer worker in place or an advanced experience practitioner that oversees their service area. So we have had to hold the line often around that and really ensure that actually if we are going ahead with the recruitment, we do have the proper infrastructure in place for that. All of our recruitment is done sort of jointly with the service areas. So whilst our peer workers and senior peer workers and some of our advanced experience practitioners are line managed locally by the service that they're employing them, we have an additional kind of input into the recruitment, the supervision of these roles. So all the recruitment is done jointly. We hold our job description centrally. And we have really good working relationships with our recruitment teams. So if there are any roles that are being recruited into that have peer or lived experience in the title that we're not aware of, we will be notified, because that is something that used to happen a bit earlier on before our infrastructures were in place, was that roles were being recruited into and we weren't aware of them, and then all of a sudden we had a peer worker and they don't have supervision structures in place and all of that. So we undertake a recruitment jointly. We do joint shortlisting interviews. At interview we ask for people to share a bit about their recovery journey, and that's really important for us to be able to kind of get a sense of where people are at and whether they are willing to kind of bring their lived experience in that professional way to work. What happens actually even before recruitment that we really, I think, we have to actually refocus on, this is something that I've recently been kind of reflecting on, actually we've maybe let slip a little bit, and it's so important, is we have what we call team preparation sessions with a service beforehand, and that's really to, you know, get the team to really understand what the role is about, what their expectations might be, but also a bit for us to sense check whether actually a service is in a position to be ready to actually embrace lived experience and embed it properly, because otherwise we're setting up people to fail, really. So a team prep happens even before recruitment happens. We're quite keen on ensuring that most, you know, as much as possible, our roles are permanent roles. We do sometimes have fixed term roles. That's inevitable with some of our service areas that are commissioned sort of, you know, for chunks of time, but we do try and make sure that we have permanent roles where possible, because we find that we can do recruitment a lot better because we can take our time and make sure that we're getting the right person, but also the job, just, you know, giving people job security is really important. So and then once someone is in post, we've got sort of a triad of supervision. So people are line managed locally by line managers. If they do have, you know, if they work clinically, they will also have a clinical supervisor. Sometimes that's the same person that line manages them. And then there is a peer professional lived experience supervisor, sort of depending on where their role is, and they do that kind of that level of supervision, sort of really looking at what it means to bring yourself to work in that way, and really kind of the complexities around this role. And we also have mandated reflective practice for all of our peer workers across the organisation. That happens every 2 months, and that's sort of with other peers across the organisation, and it's led by our leadership team. And again, it's sort of an opportunity to reflect on the work, but in a group setting. And we've got quite a bit of training that we offer. So all of our entry-level roles will start with, you know, all of our staff have a probation period, but within the probation period for our peer roles, we've got a peer worker foundation training, and that sort of, they will go through that with their supervisor in the first 8 weeks of their role. And then once people have been in post for a little while, they start our developing expertise and peer support course, which is our level 4 accredited training. Alongside that, we have sort of regular CPD. We've got lived experience training sessions that are run by our workforce. We've got peer supervision training, so any of our peers that do provide professional supervision have training around that. And we're working at the moment on an additional layer of training for our more senior and leadership roles.
I think it's just really stands out how robust that kind of infrastructure is. And I think, you know, peer support isn't peer support without lived experience. And actually, you've really honed in on how that's supported within the workforce and supporting people to bring that into the space. And actually, and I think something that is so crucial is that team prep work that you've spoken about, you know, when there is sort of multidisciplinary teams involved. I think we are coming to the end-ish of our 15 minutes, Fran, but I would like to sort of finish up on just a bit of looking to the future. I know you have launched a new workforce strategy, very exciting. And yeah, just, you know, what's your ambitions for the future of the lived experience workforce in your trust?
Yeah, absolutely. So yeah, we just a couple of weeks ago launched the first ever strategy that we've had for our workforce, and it sort of spans the next 5.5 years, so until 2030. It's essentially divided into 4 kind of separate areas, so I'll just really briefly touch on them. But so one is around literacy and value, so really ensuring that that the wider workforce at CNWL really understand what peer working is, and they value the offer that we make as a workforce. And part of that will look at sort of expanding our training offer for our staff, but also not just internally, actually externally too. And also maybe, you know, the hope is also to create a bit of a research hub, so that then we can disseminate the research that we, you know, that we might kind of be able to put together around the effectiveness of these roles, and ensuring that the organisation understands it. The other bit is around kind of access, so ensuring that actually anyone that comes into contact with CNWL services can have contact with a peer worker should they need to. So that really that's about expanding our workforce and ensuring we've got the appropriate infrastructure to do that. Then we are looking at service cultures, so really supporting and inputting into our clinical and corporate services, supporting the recovery focused practice in the way that the organisation works with people accessing services, as well as those that work in our services as well. So we really find that there's something that we can offer for our wider staff workforce, because we know that a lot of professionals within the workforce that aren't part of the peer and lived experience workforce might have lived experience as well. So how do we support them through our work? And the other is around our career pathways and justice, equity, diversity and inclusion. So ensuring like robust career pathways and really supporting our communities to enter the organisation so that we're reflective of the communities we serve. So that's really kind of in a nutshell what we're hoping to do over the next over the next 5 years.
The next few while. Yeah, thank you so much. And I think that gives us a really good sense of the direction as well. And yeah, thank you.